For my inclusive health assessment topic, I chose to focus on the LGBTQ2S+ population, which stands for lesbian, gay, bisexual, transgender, queer, two-spirit, and other sexual and gender diverse individuals. The LGBTQ2S+ community represents a significant and diverse group within Canada's healthcare system. Despite major progress toward equality, many individuals in this community continue to face discrimination, stigma, and exclusion in clinical settings, which affects both their physical and mental health outcomes, according to Rainbow Health Ontario 2024. Historically, healthcare environments haven't always acknowledged diverse identities and bodies. This has led to avoidance of care, delayed diagnosis, and mistrust toward healthcare providers, as highlighted by the Canadian Nurses Association in 2020. In this presentation, we'll focus on how nurses can apply inclusive, culturally safe, and trauma-informed approaches during health assessments to promote trust, dignity, and safety for LGBTQ2S+ patients. According to Women and Gender Equality Canada 2025, about 1.3 million people, or 4.4% of Canadians aged 15 and older, identify as part of the LGBTQ2S+ community. Within this population, 10.5% are youth between the ages of 15 and 24, highlighting the growing visibility of younger generations. Additionally, 8.1% of respondents identified as transgender or non-binary, showing the diversity of gender identities within Canada's LGBTQ2S+ community. I chose this topic not only because it's relevant to nursing practice, but also because it's personal to me. As someone who's part of the community, I believe it's important to understand how healthcare can become more inclusive, respectful, and safe for everyone, regardless of gender identity or sexual orientation. Many members of the LGBTQ2S+ community experience specific challenges during physical assessments. First, there's fear and mistrust. According to Rainbow Health Ontario 2021, many patients have had prior experiences of discrimination, such as being misgendered or asked insensitive questions, which can create anxiety about physical exams or even prevent them from seeking care. Second, there are assumptions about gender or sexual orientation. The Canadian Nurses Association 2020 explains that using heteronormative language or assuming gender identity based on appearance can alienate patients and discourage open communication. Third, trauma triggers are common, especially among trans and non-binary patients. The Public Health Agency of Canada 2018 notes that physical assessments involving disrobing or genital exams can re-trigger previous trauma experiences if consent, privacy, and sensitivity aren't prioritized. And finally, systemic barriers also play a role. Rainbow Health Ontario 2024 points out that limited provider education and inadequate intake forms often prevent accurate, respectful documentation of pronouns and gender identity, leading to more harm and discomfort. Now, let's look at 4 key evidence-based practices that nurses can apply to make their assessments more inclusive. For culturally safe communication, according to the Canadian Nurses Association 2020, cultural safety means recognizing and addressing power imbalances and promoting respect for every person's unique identity. In practice, this means creating a safe space by using inclusive language, asking open-ended questions, and avoiding assumptions. These small changes can have a powerful impact on trust and communication. For trauma and violence informed care, the Public Health Agency of Canada 2018 emphasized that trauma informed practice is built on five key principles: safety, trust, choice, collaboration, and empowerment. During an assessment, this can look like explaining each procedure beforehand, obtaining explicit consent, and allowing the patient to stop or pause if they feel uncomfortable. These steps restore control and reduce anxiety, especially for patients who may have experienced past trauma or discrimination in healthcare settings. Rainbow Health Ontario 2021 recommends that nurses base their assessments on anatomy rather than perceived gender. This means focusing on the body part present rather than making assumptions about what care is needed. For example, a trans man who still has a cervix should continue receiving cervical cancer screening, even if his gender identity is male. This approach ensures comprehensive, evidence-based care without reinforcing harmful gender assumptions. It also helps normalize inclusive language, using terms like chest area or genital region instead of gendered labels. Rainbow Health Ontario 2024 also highlights the importance of inclusive environments, such as having gender-neutral signage, private changing areas, and documentation systems that allow for chosen names and pronouns separate from legal information. Similarly, the Canadian Nurses Association 2020 reinforces that recording a patient's chosen name and pronouns is not only respectful, but also a part of culturally safe, person-centered care. The goal is to make patients feel safe and validated from the moment they enter the healthcare environment. So how can we bring these practices into real nursing care? Here are a few examples. Greet patients using their self-identified name and pronouns, and if you're unsure, ask respectfully. Always explain procedures before touching. For example, I'm going to assess your breathing now. Is that okay? Use neutral anatomical language like chest instead of breast or genital area instead of gendered terms. And lastly, recognize intersectionality. For example, a Two-Spirit Indigenous person may carry both colonial and gender-based trauma. Understanding these overlapping experiences helps nurses provide truly holistic care. Now let's consider a quick example. A nurse is performing a routine head-to-toe assessment on a non-binary patient. Before starting, the nurse introduces themselves and shares their own pronouns, then asks the patient's pronouns in return. Throughout the exam, they explain each step before doing it, ask for consent, and offer breaks if the patient feels uncomfortable. This approach, described by the Canadian Nurses Association 2020 and the Public Health Agency of Canada 2018, reflects trauma-informed and inclusive practice that promotes dignity, safety, and trust. In summary, inclusive and trauma-informed assessment practices help LGBTQ2S+ patients feel seen, respected, and safe in healthcare environments. By combining culturally competent communication, informed consent, and respectful documentation, nurses can build strong therapeutic relationships and improve health outcomes. As supported by Rainbow Health Ontario 2024, Canadian Nurses Association 2020. As future nurses, it's our responsibility to integrate these values into our daily practice to ensure that every patient, no matter who they are or how they identify, receives care that honors their dignity, autonomy, and identity. Thank you so much for listening.